Hey, welcome. Today, we're going to get you geared up with some essential Spanish for any health situation you might run into abroad. The goal is super simple, to give you the words and the confidence to turn what could be a really stressful medical issue into something you can totally handle. So let's jump right in. I mean, just imagine this for a second. You are on the trip of a lifetime, and you wake up one morning feeling just awful. Yeah, that's a nightmare scenario, right? Especially when you're in a place where you don't speak the language. But trust me, knowing just a handful of key phrases can make all the difference between total panic and feeling in control. So today, we're going to walk through what this looks like, kind of like a patient's journey. We'll start with those first signs that you're getting sick, then move on to visiting a doctor, figuring out your treatment, talking about wellness, and finally, what to do in a real emergency. Okay, so first things first, you're feeling unwell. The absolute first step is just being able to explain what's wrong in a really simple and clear way. The one word you absolutely have to know is el dolor. It just means pain. Seriously, this is your starting point for describing almost any physical problem. It's easy, it's versatile, and everyone in a medical setting is gonna understand it instantly. And you know what? Building a sentence with this is actually super easy. Me duele literally means it hurts me. So you just add the body part like me duele la cabeza, my head hurts. For other things you can use tengo, which means I have. Tengo fiebre, I have a fever. Tengo tos, I have a cough. See? It's a really simple and direct way to get your point across. All right, so you've figured out what's wrong, but it feels like it might be more than just a little cold. It's time to see a pro. So how do you even do that? This right here is your golden ticket. Quisiera hacer una cita con el médico. It's polite, it's direct, and it's exactly what you need to say to get that appointment and open the door to getting the help you need. Okay, you're in. You got the appointment. Now what? Let's play this out a bit and walk through a typical conversation you're likely to have once you're in that doctor's office. You're probably going to hear this question first. The doctor just wants to know how long you've been feeling this way. Knowing this question is coming helps you stay calm and ready to answer. And here's how you answer, super simple. The basic formula is hace number días que tengo symptom. So you could say hace 2 días que tengo tos, or maybe hace un día que tengo fiebre. You just pop in your own details. It's a great little formula for giving a clear, helpful answer. Now, this is a really important one. Don't just sit there and wait. Asking, ¿necesito tomar medicamentos? Do I need to take medication? Shows that you're taking an active part in your own care, and it helps you get a clear picture of what the next steps are. All right, the doctor's figured it out. You've got a diagnosis. Now comes the part that can feel a little intimidating, the treatment plan. But don't worry, we're going to break it right down. Getting better really boils down to these 4 simple steps. And pay attention to the key words here. La receta for your prescription, la farmacia is the pharmacy, and el tratamiento is the treatment itself. Knowing these will help you find your way through the whole process. Okay, this is a super important one. La receta. Now, this isn't a recipe for food, I promise. It's your medical prescription. It's that official piece of paper you have to take to la farmacia to get your medicine. It's a really important little distinction to remember. Okay, so we've been talking a lot about what to do when things go wrong. But what about, preventing them from going wrong in the first place? Let's switch gears and talk about proactive wellness. And really, the language of wellness is all about these simple swaps. So instead of fumar, which is smoking, you focus on hacer ejercicio, to exercise. Instead of getting stressed out, the goal is to dormir bien, or sleep well. These are just universal truths for a healthy life, right? And it's not just about the physical stuff. True wellness is about the whole picture. It's la dieta equilibrada, a balanced diet for sure, but it's also la salud mental, your mental health, and el bienestar emocional, your emotional well-being. It's a holistic approach that matters no matter where in the world you are. Okay, let's talk about the serious stuff. We've saved the most critical part for last, because in a real emergency, there's absolutely no time to hesitate. You need the most direct, most effective words, and you need them now. This is it. This is the phrase, necesito ayuda. If you forget everything else we've talked about, burn this one into your brain. It's simple, it's powerful, and it cuts through any noise or confusion. Now, if things are really serious, this is your next move. Llama a una ambulancia. And notice this isn't a question. It's a command. It conveys that this is urgent and leaves absolutely no room for any misunderstanding. Okay, quick. Think about it. You've shouted for help, but you might need to get to that help yourself. In a real emergency, what's the single most vital question you need to be able to ask? And that's it right there. ¿Dónde está el hospital más cercano? Where is the nearest hospital? Because knowing where to go is every bit as important as knowing how to ask for help. This question is your lifeline to getting care immediately. So there you have it. We've walked through the whole journey, from a little cough all the way to a major emergency. You now have a toolkit of words to help protect your health and your peace of mind while you're traveling. So the real question is, how does having this knowledge change the way you'll approach your next trip? Thanks for joining me.